Hello, my name is Crizel. I work as a nutrition nurse practitioner at Harlow Hospital. This video will demonstrate how to start and manage a parenteral nutrition, or PN, in accordance to our trust policy. Before initiating a PN, verify the following: the treatment plan, including the indication for PN, your patient's identity and details, including allergies, the availability and patency of the designated PN vascular access, the PN prescription, ensuring it is correctly completed and signed by the prescriber. Once all information is confirmed, prepare the required equipment: IV stand, IV infusion pump, IV giving set with space line, lipid filter, universal aseptic pack, a 10 ml lower slip syringe, 10 ml normal saline for injection, 2% chlorhexidine in 70% alcohol swab, and of course, the parenteral nutrition bag. Ensure that all equipment is in date and has not passed expired. Importantly, the PN bag must be removed from the refrigeration at least 2 hours before administration, and check the bag for signs of leakage, any particulate matters, presence of sediments, or any signs of discoloration before use. After preparing your equipment, verify the PN prescription with a second registered nurse. Access the prescription via Alex Health, open the form browser, and compare the electronic prescription with the label on the PN bag. At this stage, also confirm with your colleague that the PN bag is compatible with the patient's vascular access device. Proceed to your patient and follow all infection prevention control measures as per trust policy. Apply the appropriate PPE using aseptic non-touch technique. Remove the cap from the PN administration port. Clean the port using 2% chlorhexidine 70% alcohol swab. Allow the site to air dry completely. Close the roller clamp on the IV giving set. Additionally, ensure that the air vent from the IV chamber is closed. Remove the protective cap and spike the infusion port of the PN bag. Attach the lipid filter to the lower lock connectors at the end of the giving set. Gently mix the PN bag. Place it inside the protective light bag and hang it on the IV stand. Prime the IV tubing, ensuring that both the line and the lipid filters are fully primed. Once the PN system is ready, return to the patient. Maintain aseptic non-touch technique throughout and commence the prescribed infusion using the IV pump. After the procedure, document the administration clearly and completely in accordance with trust policy. Dispose of all used equipments and consumables in the appropriate waste streams. To discontinue a treatment, first, disconnect the PN line from the patient. Remove the IV giving set from the infusion pump and dispose all remaining components in accordance with trust policy. Please note, once the PN line has been disconnected, it must not be reconnected to the patient's line, as this may increase the risk of PN-related complications. The TPN service run between 9 o'clock in the morning until 12 midday from Monday to Friday, excluding weekends and bank holidays. For any TPN queries, feel free to contact us through Alertive at TPN Team, TPN Pharmacist, Duty Adult Dietitian, or Nutrition Practitioner.